Recently, I think there has been a shift in the PT world when it comes to active versus passive treatment. I feel like there's almost a feeling of animosity towards passive treatments. But before we look further, we first have to understand what are passive treatments. In general, passive treatments are interventions that are done to the patient. Things like massage, e-stim, cupping, dry needling, anything that is being done to the patient. But wait, what's wrong with all these treatments? It all comes down to building patients' self-efficacy. According to Google, self-efficacy is one's belief in one's ability to succeed in specific situations or accomplish a task. One's sense of self-efficacy can play a major role in how one approaches goals, tasks, and challenges. So basically, self-efficacy is like how much you think you are in control. If you have a high sense of self-efficacy, you generally think that you are in control and you can take actions to improve your life situation. And if you feel like you have low sense of self-efficacy, you may feel like you're not in control of your life, that whatever you do, your life situation just is not gonna get any better, or it's just not gonna change. You see, there's really nothing wrong with these passive treatments per se, but more so if you're overutilizing these passive treatments like massage and dry needling, that's when you can possibly create harm. You see, in physical therapy, we want patients to be independent. Ultimately, we don't want them to keep coming back. But if your treatment model is heavy in manual therapy, heavy in dry needling, heavy in lasers or ultrasound, whatever modality of your choice, that can create a sense of dependence. So it really comes down to how you package your treatment and how you deliver that to your patient. If you have 30 minutes with a patient and you are spending 15 minutes on the hot pack, 10 minutes getting massaged, and prescribe 2 low-level exercises, what kind of message would that send to the patient? They may feel like they need to be fixed, especially if you're providing that type of treatment with the narrative of I'm using my hands to alter your structure and fixing you up so you can be all balanced and corrected. When you use a language like that in combination of this form of treatment, that's when it really can take power away from the patient and decrease self-efficacy. Especially as more and more research are coming out saying that manual therapy actually doesn't do what we used to think that it does. I won't go into detail about each specific topic in this video because it would just go too long. But there's evidence saying that even with basic spinal motion palpation between therapists, there's a high level of variability and it's not that reliable. So they looked at the reliability of static spinal palpation in this literature review. So they found that palpating to find dysfunction in the spine were of low reliability, but therapists were more capable of palpating for pain, and pain provocation was generally more reliable. But they go on to saying that generally patients know where their pain spots are at. Are we really assessing our ability to palpate, or are we assessing the patient's ability to recall their pain spots? Just something to think about. When I first heard about this, I was like, wow, there's no way. We spent all this time in palpation labs, learning about how to palpate each segment, learning about the motions, how to move bones. If you think about it, if we can't even agree on the specific segment that we are palpating, how can we possibly create a specific effect on a specific segment that we're often claiming that we're doing? And not surprisingly, there has been research looking at the mechanisms behind manual therapy and challenging what we used to think happens when you put your hands on a patient. In this article, they said, despite their clinical effectiveness, the mechanisms through which manual therapy influences clinical outcomes are unknown. Common clinical practices, including evaluative procedures, are intended to identify hypomobile or malaligned structures of interest and are followed by the application of specific techniques meant to correct the observed dysfunction, suggesting a biomechanical mechanism. Manual therapists continue to follow this model of clinical practice despite literature suggesting that these evaluative techniques are unreliable and their findings do not affect clinical outcomes. So basically what this is saying is that manual therapy is clinically effective, but the mechanism of why it's effective is not as well known. Active treatments, on the other hand, builds self-efficacy. Patients are more empowered through exercise to take control of their lives and get better through exercise. And there's just an abundance of research coming out supporting the use of active treatments. It showed that strength training and active treatments versus passive stretching is better for injury prevention. And there's evidence for this all over the body. Prescribing a training program for plantar fasciitis, they compare strength training versus passive stretching of the plantar fascia, and they found more favorable results with strength training compared to passive stretching. Prescribing a shoulder movement program for rotator cuff injuries, This was interesting because they looked at a self-monitored exercise program versus traditional physical therapy, and they found that long-term wise, they couldn't find a big difference. I think we have a theme here. You see, again, there's nothing wrong with passive treatments, but the focus should be active. And if you choose to perform passive treatments, it should be packaged in a way that's more evidence-informed. As Erik Meira, the host of the PT Inquest podcast says, these passive treatments are more so just feel-good treatments. But when you claim that these passive treatments are more than what they are, that's when it can become problematic. Personally, I think there is definitely a role for passive treatment in physical therapy. It helps reduce symptoms, it makes the patient feel better. You can connect with patient and talk to them while you massage them or do some form of treatment with them, but we just need to watch the narrative surrounding it. As always, if you found this helpful, like and subscribe, and there's more to come.